So what brings you in today?
My stomach is hurting really bad.
Oh, when did this start?
Last night it got really bad.
Okay.
It's been going off and on for a couple days.
Okay. And where does it hurt at?
Right up here,
Okay.
a little bit over here.
Does it go anywhere else?
Sometimes I can feel it in my back.
Okay. Scale of 1 to 10, 10 being the worst pain, how bad is your pain?
Earlier it was like a 9.
Okay.
Now it's less because they gave me medicine.
Okay. And what does it feel like? How would you describe it to me?
It's like a sharp stabbing pain. It's like a spear going right through here.
Okay. And is it all the time or does it come and go?
It's been pretty constant all day. Before that it was coming and going.
Okay. Does anything make it worse or better?
If I eat, it makes it worse. Nothing really makes it better except for the medicines they gave me.
Okay. And what did you try so far for it?
I tried taking Tums, Zantac, Tylenol, ibuprofen.
Okay. Let's see here. So we're going to go through a little bit of your past medical history here. Any history of any falls or trauma or motor vehicle accidents, anything like that?
None of that, no.
Okay. When was the last time you had anything to eat or drink?
Last night we went out to celebrate at Burgatory.
Okay. And any recent alcohol use?
No.
Okay. Any recent traveling?
No.
Any nausea or vomiting?
Some nausea, but no vomiting.
Okay. Any diarrhea or constipation?
No.
Any black stools or bloody stools?
Mm-mm.
Any blood in the vomit?
No.
Okay. Any fevers or chills?
No.
Any chest pain or shortness of breath?
No.
Any coughing or congestion or coughing up blood?
No.
Okay. Any burning when you pee, increased frequency of urination,
No,
or blood in the urine?
No.
When was your last menstrual cycle?
It's irregular ever since I had my kids, so maybe like a month ago or so.
Okay. And do you know when your last, or I'm sorry, any rashes?
No.
Okay. Any family history of anything?
My mom has like pre-diabetes, early diabetes, and high cholesterol.
Okay.
My dad doesn't really have anything wrong with him. He doesn't take any medicines.
Okay. And you said no recent traveling anywhere?
No.
Okay. So I see that they've done some blood work in the ER. They did check your urine and it did some imaging. The bedside ultrasound that the ER doctor did shows a possible gallstone in your gallbladder neck.
Mm-hmm.
Your white blood cell count's slightly elevated, but your liver enzymes and your pancreatic enzymes are all normal. You are not pregnant and there's no urinary tract infection. Your electrolytes and your kidney function are all normal, and also a normal EKG and a chest x-ray.
Okay.
So you've required multiple medications to get your pain down to 9. So now it's currently a 3.
Yes.
And then you had some IV Tylenol, 4 milligrams of morphine IV, Zofran 4 milligrams, and they gave you a liter of IV fluids.
Yes.
Okay. Oh, sorry, this is past medical history. Any past medical history for yourself?
I had thyroid ablation when I was like 14 because I had Graves' disease. So I have to take Synthroid every day.
Okay. Yeah, and then what medicines are you on?
The Synthroid, Wellbutrin for some postpartum anxiety, and I also take on birth control with NuvaRing.
Okay. And the Zantac?
And Zantac I was taking just because over the last couple of weeks or so I would get this pain and I thought it was maybe acid reflux or something, so I would take Zantac for it.
Okay. Any allergies?
No.
Okay. And you said no alcohol use, but any smoking?
No.
Okay. Any other drug use?
No.
Okay. How often do you think you have any alcohol?
Once every other month.
Okay. And where do you currently live at?
I live in my house with my husband and my kids.
Okay. Any prior surgeries?
Just LASIK surgery in my eyes. That's
Okay.
it.
And any prior pregnancies?
I've been pregnant 3 times.
Okay. And
I have
no
3 kids.
complications or anything
No.
like that? Okay. Any family history of anything?
Just like I said with my mom, and my mom has diabetes and high cholesterol. I think my grandmother actually had her gallbladder out in the past,
Okay.
and gallbladder issues.
So now we're just gonna do a quick physical exam on you and check you out here, okay?
Okay.
I'm gonna take a listen to your heart and lungs here. Good, you wanna lean forward for me?
Sorry.
Take some deep breaths for me. Good, and I'm gonna lay you back here and listen to your belly.
Okay.
And any pain when I'm pressing on you?
Right through there, it hurts.
Okay, up in here?
Mhm.
Okay. Anything down low here?
No.
Okay, good. Alright, so we're gonna keep you for observation in the hospital, to get some further imaging completed and talk with the general surgeon. You may need to have your gallbladder taken out if this stone is stuck in there.
Okay.
Okay?
All right. Thanks so much.
You're welcome. Okay.